Paper cut, it looks harmless at first, just a tiny slice across the skin from a sheet of paper thinner than a fingernail. But seconds later the burning begins. The reason it hurts so much is because paper cuts usually happen on fingertips, one of the most nerve-dense parts of the human body. The cut is shallow enough to avoid major bleeding, but deep enough to expose thousands of pain receptors directly to air. Every movement keeps reopening the wound. Even washing your hands suddenly feels like acid touching exposed nerves. But here's the strange part. Your brain reacts more strongly to unexpected pain than predictable pain. That tiny cut catches humans completely off guard, forcing the nervous system into full alert mode over something almost invisible. Bee sting? For most people, a bee sting lasts a few painful minutes before fading away. But pain from venom is different from ordinary injury because the body is being chemically attacked. Bee venom contains compounds designed to trigger burning sensations and inflammation instantly. The real danger is not always the sting itself, but how the immune system reacts afterward. Some people experience swelling so intense their skin becomes hot and tight for hours. Others enter anaphylactic shock, where the immune system overreacts so violently that breathing starts shutting down. What makes stings terrifying is how quickly pain escalates from irritation to panic. 1 second it feels manageable. Then suddenly the body realizes something toxic has entered the bloodstream and survival instincts take over. Migraine, this is where pain becomes psychological warfare. Migraines are not just headaches. During severe attacks, entire sections of the brain become hypersensitive to light, sound, smell, and movement. Some people temporarily lose vision before the pain even begins. Others vomit repeatedly while feeling like their skull is being crushed from the inside. The terrifying part is that migraines can last for days without stopping. Imagine lying in complete darkness, unable to tolerate even the sound of someone speaking nearby. But here's the problem. Scientists still do not fully understand why migraines become so extreme. Painkillers often barely help because the nervous system itself starts malfunctioning. The brain essentially turns ordinary sensory information into torture. Kidney stones. Few pains terrify doctors more consistently than kidney stones. These tiny crystal formations travel through narrow tubes connecting the kidneys to the bladder. The problem is that those tubes are never meant to pass sharp, solid objects. Some kidney stones feel like broken glass scraping through the body from the inside. Patients often collapse screaming, unable to stay still because movement changes the pain every second. Many describe it as worse than childbirth. The body reacts violently too. Sweating, vomiting, shaking, and panic become common because the nervous system interprets the situation as catastrophic internal damage. But this is where it gets worse. Some stones become lodged halfway through the urinary tract, creating waves of pressure that continue for hours or even days before finally passing. Broken bones. The human skeleton is designed to survive enormous force, which is why breaking a bone feels so unnatural to the body. The instant a fracture happens, nerves surrounding the bone fire massive emergency signals directly into the brain. Some people hear the crack before they even feel the pain. Others immediately lose strength in the injured limb because the brain temporarily disables movement to prevent more damage. Compound fractures are even worse. In those injuries, the broken bone tears through muscle and skin, while surrounding tissues become shredded internally. Adrenaline sometimes hides the pain for several minutes, but once the shock fades, the body realizes something has gone horribly wrong. Even breathing can become painful because the nervous system keeps amplifying every movement near the injury. Burns. Fire creates a completely different category of suffering because it destroys the body layer by layer. First-degree burns damage the surface of the skin and create sharp stinging sensations similar to severe sunburn. But second-degree burns become far more horrifying. At those levels, heat begins destroying deeper tissues, nerves, and blood vessels. Some severe burns initially feel numb because the nerves themselves have been killed. But surrounding areas continue screaming pain signals into the brain nonstop. The real danger is how burns keep worsening after the initial contact. Heat trapped inside tissue continues cooking cells long after flames disappear. Even air touching exposed burned skin can feel unbearable. Recovery becomes its own nightmare because damaged nerves regenerate slowly, meaning pain can continue for months. Cluster headaches. Doctors sometimes call these suicide headaches for a reason. Unlike migraines, cluster headaches attack with sudden explosive intensity focused behind one eye. Victims describe it as a burning knife being driven into the skull repeatedly. During attacks, people often pace uncontrollably because sitting still becomes impossible. Some slam their heads against walls trying to distract themselves from the pain. The real horror is the timing. Cluster headaches often strike at the exact same hour every day, waking victims from sleep with unbearable agony. Tears pour from one eye while the nose clogs on the same side of the face. Scientists believe the attacks are linked to abnormalities deep inside the brain's pain control system. But despite modern medicine, many sufferers still experience attacks so severe that ordinary life becomes impossible. Childbirth. Human childbirth pushes the body to physical extremes few other experiences can match. During labor, powerful muscle contractions force the uterus to squeeze repeatedly for hours or sometimes even days. As pressure builds, surrounding nerves in the pelvis and lower spine become overwhelmed by pain signals. But this is where the body becomes truly terrifying. The pain constantly changes. Early contractions feel manageable at first, then gradually intensify into waves so strong some people lose the ability to speak during them. Bones shift slightly, muscles tear, blood vessels rupture. And despite all of it, the body continues pushing forward automatically. Yet childbirth also reveals something incredible about human survival. The brain releases massive amounts of hormones during labor that help people endure pain levels that would normally completely shut the body down. Severe nerve damage. Most pain begins in the body and travels to the brain. Nerve damage reverses that process entirely. When nerves become damaged by injury, disease, or trauma, they can continue firing pain signals even when no danger exists anymore. Imagine feeling burning electricity across your skin every second of the day without relief. Some patients experience sensations so extreme that even soft clothing touching the skin becomes unbearable. Others feel phantom pain from limbs that no longer exist. The brain keeps searching for signals from body parts that are gone and accidentally creates agony from empty space. This is where human pain reaches its most disturbing form because the suffering no longer serves any survival purpose. The nervous system itself becomes trapped in permanent alarm mode, turning the body against its own mind.